I remember back in the day, I did an implementation in an outpatient setting for an EMR, and we were lucky enough to have a physician champion, and we selected a physician champion for each of our specialties.
Mhm.
So again, like you can't do like a one EMR fits everybody's needs, right? But you
Nope.
can also make it so you feed everybody's needs too, because then you get into the very specialized workflows or into the very customized, and then to get out of there is so difficult. So you get the physicians trained, and then you get them engaged through the process to make sure that they're happy with what they're doing and that they're effective. But how do you keep that communication with them? How do you ensure that they keep that momentum and that you continue to collaborate?
Yeah, that is always a challenge to keep that momentum going, particularly with changes in healthcare overall, those ups and downs that we all experience at our own organizations. But for me, it's about staying focused on making it about providing safe, quality patient care and that patient-centered experience, but without overburdening the providers. And so keeping the emphasis on that, all of us physicians want to provide the best possible care to our patients, the best possible relationships with our patients. And if I can stay focused on those things and find ways to minimize the burden within the EMR to accomplish that, it makes it better. I participate quite heavily in all departmental meetings within the organization, so I'm always there for the providers from that perspective. I provide updates on what's going on. I do send out emails. They're not often read, so I also get people on the floors, rounding with them. I hang out in the doctor's lounge. I grab people for 5 minutes while they're at work. Yesterday, I met with one of the orthopedic physicians on something I've been wanting to show them for a while. Like they've asked for something, get with them, show them what we created for them. A physician will text me and say, hey, I would really like this within the system. I spend a few minutes talking to our IT staff, or I just play around in the system myself, figure out that I can do what they want very quickly. And then that afternoon, be able to produce it for them in the EMR and get those small wins whenever we can. And I think that really helps keep them engaged. They realize if they share feedback with us and we act on it, when we can get results back to them very quickly, they know that for those things that take longer, we're going to be working on that as well. And that constant communication and being a peer with them where I'm seeing patients and they know I'm not just in an administrative role only. They know I'm going through the same things. I have the same challenges. And so they're not afraid to share with me what they would like to see better. I can't fix it all, but the things that I can improve for them, I act on it in a timely a fashion as I'm able to, sometimes with new expenses, but most of the time just with reworking what we already have and providing education and reinforcement for it.